Welcome to Medicine in Small Doses with Dr Amobi, the podcast that explores the intersection of health, wellness and empowerment. I'm your host, Uju, and I'm going to tell you a bit about Dr Amobi before we actually get round to speaking to him. Okay, so Dr Amobi is a renowned healthcare veteran, British-Nigerian doctor, and an advocate for transformative healthcare practices. With over 20 years of experience in healthcare, Dr Amobi has dedicated his career to empowering individuals to take control of their health and well-being. As an executive coach for high net worth and ultra high net worth individuals, he has guided countless individuals on their journeys towards optimal health and vitality. Currently serving as the Chief Medical Officer of the Lifestyle Wellness Clinic and Passport Health UK, Dr. Amobi's leadership and expertise are instrumental in shaping innovative healthcare solutions. His invaluable contributions extend to his role as the lead doctor in the Women's Health Clinic, My Menopause GP, where he specializes in providing comprehensive care and support for women navigating the menopause journey. But Dr. Amobi's impact reaches far beyond his clinical practice. As a member of the Diabetes and Menopause Board, he actively collaborates to drive advancements in the field, combining his deep knowledge of diabetes management and women's health. His recent appointment as a clinical champion for Diabetes UK further solidifies his commitment to making meaningful differences in the lives of those affected by this condition. Dr. Amobi's expertise has been recognized on a global scale. He has graced the stages of major conferences, captivating audience with his insights into health issues that disproportionately affect the Black population in the UK and the US. Through his engaging talks, he advocates for health equality, encourages preventive care, and empowers individuals to embrace lifestyle medicine as a powerful tool for transforming their health. Today, we have the privilege of tapping into Dr. Amobi's wealth of knowledge as he joins us to discuss the fascinating topic of using lifestyle medicine to prevent, treat, and even reverse type 2 diabetes. We'll explore the 6 pillars of lifestyle medicine and also learn practical strategies to integrate them into our lives. Get ready for an enlightening and empowering conversation as we dive into the world of lifestyle medicine with the incredible Dr. Amobi. Please welcome me in joining him today.
Thank you so much. That sounds amazing. When you're reading that, I was like, wow, you're talking about someone else.
I talk about someone else. No, it is you indeed that we are talking about, Dr. Amobi. Thank you for your time this afternoon. So, we have this great catalogue of experiences that you've been doing. And what we want to talk about today is, what we're really going to look into is, before we go into how we can improve diabetes with lifestyle medicine, can we just talk about type 2 diabetes? What are the symptoms and the consequences of not doing anything, particularly for Black people?
Brilliant. And that's a very fantastic question. So, if you don't mind, I'm going to throw that question straight back at you.
Oh, sure, doctor.
What would you say type 2 diabetes mean to you?
My understanding of diabetes in a nutshell is that someone who is diabetic has too much sugar in their bloodstream, and they need to kind of get it under control using medication such as insulin. Yeah, that's really all I know. But I also, there's some people that have been known to my family that have unfortunately passed from diabetes, or as a result of diabetes, due to a diabetic coma. But that's as much knowledge as I have.
Yeah. And that's a very fantastic way of, shortening the answer. And I'm sorry about your people that that have been through this process. Now, one of the things though, and I'm very happy that we're talking about type 2 diabetes. The question I ask is exactly what I ask anybody who walks in my clinic, and I ask them, what does that mean to you? Because it's always a good idea to get an understanding of where people are at. All right. So I call it sugar poisoning. Even when you go to villages, I remember when I asked a Nigerian grandma who was visiting to the UK, and I said, what is type 2 diabetes? Of course, she said to me in Igbo, she goes, urea sugar. That means like disease of sugar. Okay. And that's from what she said, that's how I coined that disease as sugar poisoning. And you may want to say, okay, cool. Why is it a poison? And what happens in type 2 diabetes is because your body is unable to take away sugar and store them outside your bloodstream, because if sugar stays in your blood too long, it causes a lot of problems.
Right.
Ideally, an average person has about 1 teaspoon of sugar in their bloodstream at any given time. So the way your body works is that if your blood sugar level increases far above or below 1 teaspoon, your pancreas will then release a hormone called insulin to keep it in balance. Now, it's a disease that creeps up on people a lot. All right. There's so many risk factors that come with it. Say, for example, if your mother has or your father has diabetes, your risk of type 2 diabetes, for example, your risk of developing type 2 diabetes is like about 15%. If both of your parents have diabetes, you are up to 75% more likely to get type 2 diabetes, right?
Wow.
Now, as Black people, we are 4 times, I'm talking about UK, US, we are 4 times more likely to develop type 2 diabetes. Why? Because of so many lifestyle changes at the moment that is making us eat more processed food than exactly the way God designed them to be. And we're going to touch on that when we talk about the lifestyle measures to be able to counter that. But you may want to ask, okay, cool. So how would somebody know that they have diabetes? I would say that in clinical practice, about 40% of my patients will be people that we diagnose without them knowing they have 0 symptoms.
Wow.
They're coming for regular checks and they would have it, right? And
so there are people walking around that may have it now that are unknowing or...
Absolutely. I think it's estimated about 5 million people in the UK today have type 2 diabetes without knowing that they do have it. So it's extraordinary, you know, and before it takes on average between 5 to 10 years before we actually diagnose people, because if nobody comes to get the test done, etc.
Yeah, of course.
Yeah, and they're not having any symptoms.
Why would you?
Right? And people, diabetes has become so common language today that people very seldom come to clinic to say, can I check for my diabetes? Because almost everybody around them have it. And they can see them walking around and happy, doing so many things.
That's a great point, right? Doctor, because if someone said they're diabetic, you're like, oh, okay. But if they said, you know, I've been diagnosed with cancer, then the shock and the concern is a lot different as opposed to maybe diabetes will be, oh, okay, well, you know, who doesn't? Or everyone knows someone that has it, so...
Yeah, and what you said is absolutely true, because what tends to happen, particularly in clinical practice, even when you diagnose somebody with diabetes, some people will say, oh, I wasn't surprised that I have it. You go, why? They go, because my mom had it, my dad had it, or my uncle had it, etc. They don't look at it from a concerned perspective that you get a condition that can potentially kill you if you do anything about it. And that's one of the reasons why we, talk a lot about it. I go to churches, I talk in youth communities. I speak nationally, internationally about diabetes because people are not taking, particularly in our community, the Black community, we're not taking it
We're not taking it seriously. So then, Doctor, do you want to just highlight again what are the symptoms and just so that people are clear on, there's no, you said it can be symptom free, is that right? Or do you want to just clarify that?
Yes. So most people may be going through it without knowing at all. Even some people who got symptoms may not recognize that those are symptoms of diabetes.
Right.
Like, for example, thirsty. If you live like in a country that is hot, you're drinking a lot, right? Unless you pay particular attention and realize that, wow, you're becoming more thirstier than usual. If you are, I want you to go and get checked for diabetes.
Okay.
If you're passing more urine than usual, I want you to go and check for diabetes. If you're getting blurred vision,
right?
If like your eyesight is changing and you're not quite sure, check for diabetes, because diabetes can cause eye disease. Unusual tiredness, check for diabetes. You're losing weight unintentionally, or you're actually gaining a lot more weight than usual, I want you to check for diabetes. So these are some of the common symptoms that we see. Sometimes people come with thrush, right? So people, they get a thrush in their mouth, they get vaginal thrushes. These are like, people, if you get like a lot of white discharges coming out to your private area, get it checked. If you have wound that is not going away, get it checked. As a matter of fact, go get checked. Don't wait for this thing, because the thing though is when these symptoms start coming, it tells me that you have had this thing for years.
Right.
And this is the time
alarm bells are going off.
Because what your body does, and this is one of the most beautiful thing about how God made the human body, is your body always fight for you. Mm-hmm. When you are in the early stages of having diabetes, your body will be making too much insulin to counteract the sugar. It will walk and walk until it gets tired. It goes, look, I can't handle this anymore.
Right.
Bang. All of a sudden it looks like it's just something you developed yesterday. No, it doesn't typically happen that way. Most people are type 2. We're talking about type 2. We're not talking about type 1.
No.
The difference between the two is because type 1 is basically a disease as a consequence of your immune system attacking your body's ability to make insulin.
Right. Okay.
But type 2 is a consequence of lifestyle.
Right. I'm going to get into that. Yeah.
And then the other risk factors that come with it.
Thank you for highlighting that. What then, I think, are the, what are the consequences of diabetes then?
Yeah. So one of the biggies is the effect that diabetes sugar have on your blood vessels. If you are diabetic, I'm going to start from the head. Mm-hmm. We call dementia type 3 diabetes. The reason we call it type 3 diabetes is that if you have diabetes, you're 3 times more likely to develop dementia. We associate with the heart attacks because if you have diabetes, you're 3 times more likely to have a heart attack. You are 3 times more likely to have stroke, right? Mm-hmm. Permanent loss of vision. The commonest reason people have permanent loss of vision, go blind, is as a consequence of diabetes because it damages the small blood vessels of the eyes. Kidney failure. The number of people we see in clinical practice with kidney failure as a consequence of diabetes is extraordinary. So, and then the one that if you look into the UK, for example, there's 3% black people in terms of population, but we have the highest number of amputation. The number of black people who get their foot, their legs amputated
as a result of, obviously, of diabetes, which is what we're talking about today. Just to remind the listeners that everything we're talking about is a consequence of diabetes, type 2 diabetes.
Exactly.
A doctor is highlighting. Doctor, what was interest to me as well, so obviously there's only a percentage of black people in the UK and US. I know obviously a lot more of us in Africa. And the numbers already, I don't know if we have any statistics on those numbers there in Africa, or because a lot of the information we get is on the rise there too.
Yeah, because okay, US, you can always argue that US there's a multi-generational of people in the US, right? But if you look at UK, for example, at the highest level we have now is we have like at the most, I think about first or second generations. About 95% of black people who live in the UK today immigrated here after 1981, right? So it's like 41, 42 years ago. Now, some of the people who are still moving in, as a matter of fact, 2 days ago, I screened someone who came from Nigeria just recently this year. I think he arrived this year and he has diabetes, right? So, and then you go back home. The number of people with diabetes in Nigeria is extraordinary. It is so high. My understanding is the statistics is actually similar to what we have in the UK. And you can argue that this is as a consequence of certain lifestyle practices that has changed over time. I remember when I was asking my mother about this when they were growing up. I was like, Ma, did people have diabetes as much as we have now? And she was like, no, because back then they look at it as the diseases of big men, rich men. Okay. So what does that mean? That means that people who usually live in areas where they have access to processed foods, right? Right. So, you have to be rich enough when they were growing up to have access to foreign foods, right? Your baked beans, your cornflakes, your any of the processed food, right? So those are the people who started experiencing diabetes back then. But now Nigeria is like a global village. a lot is coming into the country, and there's very little regulation. And then because we like things that other people like as well, right? So when you go to hotels in Nigeria now, you'll be astonished what is actually on display.
Available.
And you're going like, where is our identity in this food that is like displayed here with some elegance and beauty, you know?
Do you think that these food packages then should come with a warning sign, just like they do on cigarettes? Or
yeah, and absolutely. And we're going to talk about food packaging and food labeling, because I think, you know, I don't think I don't know this for sure. I don't know whether there's a legislation in Nigeria that anybody who is bringing some processed food in Nigeria has to label it, and, you know, the way we traffic light it here. So I will look into that, but I don't know. That's the answer. But I don't know the exact statistics of Nigeria. Yeah. But
we know that there's a problem. We know there's a huge problem.
Because it's significant proportionally. Anytime you hear somebody, you know, when you get one of those phone calls, like, you know, somebody died, 1 out of 2 of them, you will always hear the word, I think he may have diabetes.
Right. Yeah. You've heard it there from the doctor himself. And it is a global problem. And therefore, the next question is, however, there are global solutions. And there's a solution in the form of lifestyle medicine. So, you know, if you can just tell us what lifestyle medicine is, first of all, and how it can help in is it prevention or treatment of someone who may be experiencing diabetes, pre-diabetic or diabetes?
Yeah. So lifestyle medicine is a relatively new language, but it's a very old concept. So what it basically means is that the way you live your life can affect your health. Equally, you can prevent certain diseases, you can treat certain diseases, you can even reverse certain diseases if you change those lifestyles, right?
Right.
Now, you may want to go, okay, cool. So what sort of lifestyle are we talking about? Now, we're talking about the food that you eat. Right. We're talking about physical activity. We're talking about sleep. We're even talking about personal relationship you have with people, how to reduce stress, what substances is getting into your body. So all of those things are important things, because if you look at it properly, to go back to like your great grandparents who lived in Nigeria, some of these are the practices that they never touch processed foods. No. Right? You know, they go to sleep early, even though they wake up early. Yeah. But they still go to bed early.
With the dusk till dawn sort of thing. Yeah.
Exactly. Right. You know, and they have network.
They got those hours in. Sleep.
Exactly. Right. So lifestyle medicine start taking, you know, effect over the past 20 years. It started becoming a bit more of a everyday language, because we're realizing that, like, for example, in my clinic, I run a diabetes reversal clinic. I could have I can diagnose somebody with diabetes today, and in the next 3 months or 6 months, if they do exactly what we tell them to do, they reverse their diabetes. It goes back to how its normal range.
That's great news. Is that for anyone at any age, or is it just...
No, that's anyone with type 2 diabetes.
Yeah.
And of course, type 1 diabetes.
And so the age doesn't matter how old they are. It doesn't matter as long as
type 2 diabetes, typically we diagnose in older people from, let's say, from 30s above, etc. But now, and this is another point that I wanted to raise, perhaps to do a talk on this. We are now seeing Black children, particularly African children, being diagnosed with type 2 diabetes as early as 11, 12, 13, 14, 15 years old.
So teenagers,
They haven't even hit teens yet. And it's extraordinary, because even they have it higher than the Caribbean children. Right. Right? And so I hope maybe in the future we touch a bit more on epigenetics, and there's so many other things. I'm actually getting warmed up with this.
This is like, it's just so much to unpick. But you made a great point so you're saying that if someone obviously takes on a program like yours and they follow it diligently, they can reverse and completely eradicate diabetes.
Yes.
Is that the case? Yeah. And this is by using lifestyle medicine, or, you know, lifestyle modifications and practices that will enable them to do that. And those practices sound like, well, common sense really, but we know common sense isn't always common. And we really take for granted the importance of sleep. So do you want to, perhaps, you know, explain what the pillars are, of lifestyle medicine that you use in your clinic?
Yeah, sure. Okay. So one of the number one for me is you go for the optimal nutrition, because there's no other place that you're getting this carbohydrate, this sugar, than what's going through your mouth. All right. I respect the fact that somebody, if you have risk factors, that means what are those things that may increase your risk of developing diabetes? But you haven't got it yet. The question is, how do you prevent it from happening? How do you treat it if it starts showing its head, right? And if you diagnose already, how do you turn it back? Right. Now, you go straight to the source, food. We know that processed food, for somebody to actually like make some of this food in the factories, they have to add so many additives that your immune system has never encountered ever. So what we do is we look at what you're eating. How much of the food that you're eating is carbohydrate? How much is protein? How much is fat? How much other minerals is contained in your food? Are we getting the right balance? Right? So we walk you through exactly what you needed to eat. Okay? It's some people, we don't even need to change a lot of what you eat. We just add something, an adjunct, add something a little bit.
Can you give an example? So,
okay. So I'll give you an example now. Most of our food, let's say you get rice, right? So our rice is typically, actually, let me use this example. Let's say you go to church, like some of the great African churches, you go there, they give you like jollof rice on your way out. Yeah. You get jollof rice, you get chicken, then you got plantain in it.
Yeah, during their special events or high occasions.
Malt, right?
Yeah.
Okay, cool. So how would I advise somebody who's coming home with that? And I think we'll do a video on it at some point. Then instead of sitting down and then go home on top of it and fly plantain and hit on top of it, you got plantain, which is carbohydrate, rice, huge amount of rice, which is carbohydrate. Make some beans, add to it. I will divide that rice into 4. Add more protein, right? Put fish, add beans. The good thing about beans is like even though beans contains
carbohydrate. So not baked beans, we're just going to clarify.
Regular black-eyed beans that you normally
natural chickpeas, beans, lentils, I guess.
Exactly. And then you can add vegetables. I want vegetable to make half of what that rice that you're going to eat. Okay. Get broccoli. My favorite is broccoli. Why? Because it's anti-carcinogenic. So it packs a lot of nutrients. It's extraordinary. Right. So by the time you divide that rice into 4, your rice, your proteins, the meat, the fish, the veggies, all of a sudden the picture of that food that you were going to eat from the plastic plate there has changed.
So just to clarify, protein obviously is meat as well. So meat, yeah. And that should be more than the rice.
Yeah. So your protein should be more than the rice.
Okay.
And then instead of drinking the malt, I'm not saying don't drink malt, but you can actually say to you, okay, cool. I have malt once a month. Put ice in it. Ice will, dilute it to the capacity that is less toxic. It's better than nothing. If you must drink it, add some ice or even add some water. Okay,
brilliant. So nutrition's a key role. What are the other, but it's 5 other pillars. So do you want to just go through those as well?
So physical activity is good. Okay. So you can begin with activities that you enjoy, things like.
And by physical activity, we mean exercise.
Exercise.
Yeah.
Yes,
okay.
Yes. So you do things you enjoy, walking. Instead of driving, you can walk, right?
Take the stairs.
You can take the stairs. You can go swimming. Things that we enjoy, dancing. You can come home one day, just put your flavor music on and just dance for like 10 minutes straight. That's an exercise for me. Okay. But your aim.
And that's also, I want to interrupt that because obviously as a mum with loads of kids, mum with multiple, with quite a few children, sometimes it's hard for us mums to, get out and incorporate, or we believe that it's hard for us to do that. But we can also work out with our children. And as you said, diabetes is becoming a disease that's affecting younger people. Yeah. We can start that from early. So have a dance with your children.
Yeah. That's a smart idea. Anything that you do that gives you at least about 30 minutes per day. If you've never done it before, start with 5 minutes a day. I'm happy with it. Next week, you start with 10, 15, gradual progress, right? So now the third one is, of course, like I mentioned briefly earlier, is sleep. What we advise people to do is to aim for between 7 and 9 hours. Okay. Sleep every night. And
why is that then from a diabetic perspective?
Yeah, because the thing though is, number one, you're at nighttime, your metabolism slows down. Right. So what tends to happen is when people are asleep, this is a very interesting thing. One of my patients, what happens is when she has sleep problems, she'll wake up and then she go to the kitchen and then she eats something.
Wow.
Right. And then when she eats something at nighttime, her sugar level climbs extraordinarily. Right. Because that's the time that your metabolism is very low. And we know that your body is like a self-cleansing entity. So it needs good sleep to be able to clear your system, repair itself and things like that. So if you're not getting enough sleep, evidence now is like people who got poor sleep have up to 15 to 30% likelihood of having heart disease. So sleep is extraordinarily important.
That's why we call it beauty sleep.
Exactly.
And no more midnight snacks. Right.
Yeah.
Okay.
Yeah. So stress. Now, I think one of the things, in order to do some of these things justice in terms of, all these steps, we're probably going to come back and do each of them in an extended format.
Yeah.
So that people will find it useful. But this is just a tool that you can start applying today. Stress management is important, because without that, every day your body releases cortisol, stress hormone. Stress hormone causes inflammation. Inflammation is one of the commonest reasons why we get high blood pressure, for example.
Yeah.
Right?
The only thing about stress that I find hard to manage, or maybe difficult to manage, is not identifying what is stress to each individual person. But I guess, we're going to... Yeah. So
we
have to know what is causing you distress.
What is causing you distress? That's super important. I think it's a very broad term for so many things. There are positive stress, there are negative stress. All you need to make sure is like you don't have too much of the negative stress.
Right. Okay. And then, so you would kind of manage stress by, again, I guess, getting some sleep, self-care.
Exactly. And then we say, look into like toxins, right?
Into what,
smoking.
Sorry? Okay. Yeah.
So we use things that are toxic and carcinogenic. Smoking, alcohol. Okay. So be mindful, because alcohol is seeping into Nigeria with speed in most of African countries now. And people looking at it as an elite way of living. But our body is not designed
for excess consumption.
For that type of consumption at the moment, because it's quite a new concept. We have no idea in the next 10, 20, 30 years what this new type of lifestyle, what the consequences are going to be for people who are practicing it back home. So,
and by this lifestyle, I think we mean a Western lifestyle we're incorporating into Africa a lot. Exactly. And the consequences of that may not be evident or clear for another
20, 30 years.
30 years.
So we have no idea. And what terrifies me is that there's no inbuilt system in place at present to adjudicate that. Right? Because it's like a free throw. So now, connection and support. I think that's one of the things you
probably... just about the toxins. So alcohol, I guess we need to just drink water, ideally, and juices and fresh. Yeah.
Make your own, make your own drink. If you want to add something to it, you know how I do. If I'm in Nigeria, I just I can put watermelon, guava, all of those things and shake them up and then drink my stuff. If I want something a bit more tasty. So feel free to explore with whatever nature that is around you. But water, for example, I always recommend to drink between 2 and 2.5 liters a day. And I always make sure that, I drink minimum 2 liters of water, and which gives you about 7 or 8 cups a day.
Brilliant.
Yeah. And then, the last, it's not last one, but, one of the commonly, I would say Nigerians who live in Nigeria do this way better than people who are abroad, which is having the connection and family support system.
Agreed.
So, I think it's something that we need to cherish, find your tribe, the people that have things in common with you, that have the same positive outlook in life, join support groups of people who are, into fitness, into wellness, people who talk positive, people who are going to bring good energy to you. That's the aim of life. You know what I mean?
People in the same stage of life as you, maybe motherhood or
motherhood, fatherhood,
empty nesters, or
unclehood, whatever it is.
Unclehood.
Just
right.
Find their own tribe.
Doctor's got a sense of humor too, right? Okay.
Yeah. So I think the important thing here is that to remember that some of these things that we talked about, and we will expand on it at the latter stage, so that you'll be able to follow all these pillars that we mentioned. But lifestyle changes is something that takes time and consistency. Yeah, and my advice is, if you start small and gradually build on your success, it would take you. You would not believe. One of the things with diabetes is when you're doing this great job for yourself, it may not be self-evident right away or in the next year to say, especially if you're preventing diabetes. If you have diabetes already, you will see the impact, but you don't want to get the disease to start walking backwards, right? And celebrate your achievements along the way, okay? And don't be too hard on yourself. Even if you experience any setbacks, because we're human beings, we will mess up one way or the other, but you pick up from where you stopped, you keep going, you keep pushing, all right? So every positive step counts towards a better health and well-being, and it's always, and I'm going to highlight this very, very importantly here, is that, of course, this is informational for information basis. I'm not giving any medical therapy or medical treatment here. It's always a good idea to consult with your healthcare professional or experts who look after you before you engage in any lifestyle changes.
Yeah,
exactly. Because you don't want anything to counteract with what you're taking, etc. And the doctor will know you much better. So talk to your doctor. And have a plan in terms of
maybe introduce them to lifestyle medicine. You can probably say, I want to start doing more lifestyle, introducing more lifestyle positive changes into my life. So who knows? Yeah.
And we'll probably, bring some road shows to Nigerians in the future to help. To help, wherever we can, isn't it? Yeah.
Excellent. Okay. Well, everyone, that concludes today's episode of Medicine in Small Doses with Dr. Amobi. We hope you found this episode useful, and we encourage you to share this episode with your friends, your family, and anyone that can benefit from this valuable information. By spreading awareness and fostering a culture of health, we can collectively make a positive impact on the lives of those affected by type 2 diabetes. Please also subscribe on Apple Podcasts and leave us your 5-star review. That way more people can find the podcast that we know will help them make positive changes to their lifestyle. Thank you for joining.